Start the recording now. So Eamon, over to you.
Okay, good day to everyone who's participating either as a speaker or just participating, watching. This is a very important day and a very important opportunity to talk about the most intractable of all the problems we face here, other than the virus itself. We are, of course, representing, and all our speakers, the Independent Scientific Advocacy Group, which is advocating more rigorous approach and aggressive suppression of the coronavirus, and having enormous success in persuading the public on one hand, and also people in politics, most of the opposition parties now, and indeed a growing number of people in the media, some of whom have done an about turn and are now agreeing with you. We're going to begin by asking Paul Dansy to give us a situation update. In other words, the COVID-19 and border management is the agenda here. It is a difficult problem, but there is a plan that the ISAG has drafted that may deal with it. So if I can ask you to talk first and give us a situation update, Paul.
Thanks, Eamon. So just looking at the Republic for a moment, these graphs we show the case profile over ages. We tend to use these logarithmic graphs where things go up in 1, 10, 100, 1,000, because it becomes easier to look at patterns that are emerging. In previous sessions, we've talked about how things went wrong in early December, but just now, today, things are starting to go better as all the cases are going in the right direction, lowering down. They're still higher than they ever were at any point in a very, very long time. And one of the concerning points we have at the moment is that all of the adult age groups are tracking at the same point. In previous times, we were able to separate the young away from the old and keep the cases going at different rates. And that was very good for keeping the deaths and hospitalizations down. Currently, we still have a little bit extra work to do on that aspect. As we can see, the children are being less affected. Again, that may be partly because we're only testing people with symptoms at the moment, and that tends to change a little bit when we test close contacts. Looking at Northern Ireland, very hopeful news there on an impact from the vaccine since it's rolled out. Normally, the eldest age group tends to plateau when they're working in care homes. They don't go down as fast as the rest of the population. But since they've the vaccine reached around 80% of care homes vaccinated, we could see that they're starting to follow the rest of the population in going downwards. So that's really important for now, and really good for the future as far as deaths are concerned. As Andrew on this call referred to, that's not enough for our ICU capacities or hospitalizations, because that tends to be in some of the younger age groups.
Okay, thank you very much.
Sorry, just on the B1.
Sorry, no, go ahead.
On why things are not going very well, but could be going better. As far as the so-called UK variant, we're really beating down the original variants, but it's providing a bit stubborn at the moment to get rid of B117. But it is still decreasing. It's going down, which is really important. But we could do more and get rid of it quicker if we look at how well we were doing at staying in our own localities and not passing it on to different communities. We can see back in April, there was a very small portion of people moving around. It's about twice that at the moment. Now, we're still getting good success here because we've a cohort, maybe around 10% of the population, maybe a bit more, who've been infected in some way, and they're stopping it from progressing as much because they have some immunity to both the UK variants and the previous variants. Just on that measure, there's lots that can be done. We can also just see, looking at the traffic measurements as we're looking from, say, north to south, and it's pretty much the same in and around Dublin and other areas around the country. Back 2020 January, we've really cut down traffic from that, but we're still nowhere near the levels we were at in April of during the first lockdown. Thanks, Eamon.
Okay, thank you very much, Paul. now the first speaker is Sam Scarpino. Sam has very kindly joined us from Boston, and what he's going to address is what mobility analysis can tell us about controlling the COVID-19 epidemic. So if you're there, Sam, that's what we want to hear, and we're waiting to hear you right now.
Great. Well, thank you very much, Eamon. Thank you all for the invitation. I really want to applaud this group for all of the work that they've done advocating on behalf of the kinds of scientifically driven and data-driven strategies that we've seen work internationally for controlling COVID-19. So very briefly, I'm on the faculty at Northeastern University in the Network Science Institute. I'm also external faculty at the Santa Fe Institute, primarily focused on mathematical and computer simulation modeling of infectious disease outbreaks, but then working to translate the results of those outbreaks into what we hope are improved public health and clinical decision-making. One of the things that I think is very important to remember about COVID-19 is just how heterogeneous it is at all scales. So we know that internationally, we see some countries have largely kept COVID-19 out of their borders. Other countries like Australia have eradicated it after it has shown up. And then of course, many other countries have been living with this terrible disease for going on a year now. And if we were to zoom in on the United States, where I live, we would see that different states have this same pattern. Some states have been hit much harder than others. If we zoom in on Boston and Massachusetts, we would see the same pattern. If we zoom into the city level, we would see the same thing at the neighborhood level. And of course, we see this pattern playing out across Ireland. And this is just a snapshot of cases in time to see that something that all of you understand quite well, that the landscape is very heterogeneous. And so what that means is that we need a combination of regional coordination and local strategies to move us out of the COVID-19 era. And one of the things that I want to stress, and I'll have a couple of slides to show data on this, is that the mitigation strategies that many countries have tried do not work. They don't work for the economy. They don't work for the health of the population. That the strategies that we have seen work consistently in a variety of different countries, in a variety of different settings, are these COVID elimination strategies, where you really go for the local eradication and the complete control of COVID-19. And of course, it's possible with test, trace, isolate, with quarantine strategies, and it will become increasingly possible as we move into the vaccine era and we have additional tools that we can bring to bear on the problem. So just very briefly, a couple of studies that I want to share with you that I think are relevant. So one that we published over the summer was looking at the effects of different types of population structures, primarily along urban-rural gradients, in the shape of COVID-19 epidemic. So one of the things that we're trying to explain and understand is why some locations have very sharp peaked outbreaks and other locations have very long, broad outbreaks that seem to last for months and months and months. And quite a bit of this actually has to do with the local population structure. So here's just a global map of mobility data that we use to parameterize these models of COVID-19 spread. And so I'm just showing you a snapshot of a few different kinds of cities and how their populations are distributed across the top. So darker red is more intense population, blue is more spread out population. And what tends to happen in rural areas, something that I think all of you understand quite well, is that as compared to urban areas, there are fewer people, but they are often more tight-knit in their social networks and in how they interact with each other. And so what that means is that it may take longer for the virus to arrive, but when it does, you can get a very sharp and intense outbreak that rapidly infects a large percentage of the population. So we have this kind of important distinction between what happens in urban areas where you have long, broad, lasting epidemics, and then in rural areas where you have a buffer that occurs, but then when the virus shows up, it can be quite intense. And so that's part of the reason why this combination of regional coordination, but local measures is critical for COVID-19 control and elimination. The second is that very early on, from the first days of COVID, we saw the importance of both local and regional mobility in spreading the virus around. So this is a paper that we published looking at the cordon sanitaire and lockdown of Wuhan and Hubei province back this time last year. And so here's a snapshot in time using real-time mobility data from January 1st, basically through today, but in 2020 and 2019. So 2020 in red and 2019 in gray. And in the bottom, these are just the provinces of China, with the darker red being how much mobility is happening from Wuhan and Hubei into those surrounding provinces. And what you can see is that the black and the gray, so the black and the red are basically tracking each other right until we get to that vertical bar, which is the cordon sanitaire and the lockdown of Wuhan. And a couple of things to note. One is that there was a large exodus of individuals prior to the cordon sanitaire, 72 hours before it was announced. The estimates are somewhere around 5 million people. And the second is that there was a crash in the mobility, that essentially all mobility was cut off. And what we see very quickly happening was that COVID comes under control in all of the surrounding rural and suburban areas that were previously being sustained in terms of their epidemic by mobility from this epidemic core. And so then that allows them to alleviate the measures in the rural and suburban areas as those outbreaks come under control, and then eventually do so in the urban areas. So again, this kind of distinction between what needs to happen in urban and rural areas and how you have to have regional coordination, but with a mix of local policies that are responding to the particular situation that's happening on the ground. And we're seeing this play out with the B117 lineage in the UK. So one of the things that is very important about B117 is that it arose outside of London and then quickly took hold in London and has then spread out as a result of this mobility from London. And one of the things that we've seen happen is that as the new lockdowns went into effect, the growth rates of the B117 crashed, although as we heard from Paul, it's not crashing as hard as the previous lineage of COVID-19. It's one of the reasons why it's so critical to get out in front of this. But what we can plot here on the x-axis is the mobility from London. So each dot is the UTLA. If you're familiar with it, it's basically a metropolitan area or a city. Each dot is that, and then the x-axis is how much mobility they're receiving from London, kind of on a daily basis or weekly basis. And then the y-axis is how much the variant is going up. And it's on a log scale, which, as Paul mentioned, which is why the numbers are negative. But so higher is getting non-linear more in terms of the increase. But what we see is this relationship where the places that have the highest connectivity to London are seeing this variant increase very quickly. They're seeing the growth rate of the virus increase very quickly. And then as soon as the lockdowns go into effect, as soon as we turn off that mobility, the growth rates very quickly turn negative and the outbreaks come under control. And then you're able to deploy the kinds of green zone strategies that you've heard about, where you're able to start relaxing measures as COVID becomes locally eradicated and then slowly is eradicated across much larger areas. So coordination between local and regional measures. So the last thing I want to mention is just some data that we've been looking at in Ireland to try and understand a little bit more about what happened in the last big surge. And so for me, the really key pattern that jumps out, and this is something that I'm sure all of you understand far better than I do, having only visited once, but there are a number of electoral areas that have very little to no connectivity to Dublin. And I'm just using this as a proxy for kind of how isolated or rural they are. And those electoral areas that have low connectivity to Dublin prior to this last wave had much lower attack rates, meaning that a lower percentage of those areas had been infected with COVID. So here we have green of the areas not connected to Dublin or very weakly connected to Dublin, brown are the areas that are more connected, and then the y-axis is just related to what percentage of the population had been infected prior to this latest wave. And so you see that the green box is lower than the brown, significantly so via statistical test. And what we saw is that there was an increase in this interregional mobility, but not substantially so, that led to seeding of the virus in some of these areas that had been previously isolated. But then local mobility in those areas went up, and that strongly correlated with this increase in the virus. So a combination of local mobility going up, moving around your own electoral area, your own county, but with a little bit more mobility from some of the larger urban centers bringing the virus in. And so just to show this, we have now cases per 100,000 in the recent outbreak, and then mobility, inter-county mobility, so people moving between counties. And in blue here, this is those low connected, more rural, more isolated local electoral areas. And in brown, these are the more connected ones. So you see in brown, there's this positive relationship, meaning more inter-county mobility, more COVID, which is what we've seen in past outbreaks. However, the green here is flat. There's no real relationship. It doesn't look like there's more mobility from Dublin or any of the inter-county areas that are bringing COVID in. However, when we switch to the intra-county mobility, what we see is that that brown line still goes up. So the x-axis now is mobility within the counties. And then we see this nonlinear relationship, this big spike in the green, meaning that once you get above a certain threshold with the intra-county mobility, we see all of these previously protected, isolated counties spiking in terms of COVID-19. So again, this combination of regional and local effects, meaning you need both coordination and legally targeted measures that, locally targeted measures that are responding to the particular situation in each county. So the last couple of slides, and this should say 4 instead of 3, I apologize. And this is something, again, that you've heard a number of times from this group and for others, is that there is no evidence that one can protect the economy without controlling COVID-19. So this is just a particular number. I realize that GDP is not the best measure of the economy. It's not the best measure of people's health and happiness, but it is a measure that we can use to look across countries. You see Taiwan, South Korea, other countries that have controlled COVID-19 with eradication strategies having the lowest % decrease in the GDP. And then as we march into countries that have done maybe a little bit better until recently, countries like Nigeria that have actually done quite well, we're seeing a bigger increase. We get into Sweden and Denmark, something that you've heard quite regularly, that Sweden's strategy around mitigation has not worked in terms of protecting the health, and it has not worked in terms of protecting the economy of that country. And then we get into the United States and the UK, and these numbers just spike. The website here, Our World in Data, didn't have a value for Ireland for this quarter, so I wasn't able to put it up here. In New Zealand, what they've actually seen is that the eradication measures have a lower effect on the population in terms of the stringency of the lockdowns over time than places that have tried for mitigation until recently, like Canada. So the y-axis here is just a measure of how stringent the lockdowns are, sort of how unpleasant. And you see that New Zealand has these 2 spikes where they bring COVID under control, but otherwise they've had things mostly open. Whereas Canada, the United States, most of Europe have had this kind of misery level mitigation for a year now, and we haven't really gotten the virus under control. So the take-home message is rural areas are often more susceptible to intense outbreaks. It's why it's really important that we understand and control some of these inter-regional mobility, and we really focus on areas that have had low attack rates previously. However, inter-regional mobility matters in combination with local mobility, which is why you have to have coordination across countries, across counties, across geographic regions when it comes to eradication of COVID. It's why test, trace, isolate, and quarantine is so important. And that rebuilding our lives and economy requires controlling COVID-19. There is no evidence that a mitigation strategy can be effective. So again, with that, I want to thank you all very much for the invitation and for the courage that you have to really come after this opportunity to get your lives back and regain control of the situation. So thank you.
Thank you very much, Sam, for joining us from Boston. Hugely fascinating information. Thank you so much for that. And we're going to move on now to talk to Julian Mercil. And Julian is joining us from Dublin. And he's going to talk to us about, he's a founding member of the ISAG, and he's going to join us to talk about pragmatic border management for the island of Ireland. And this really does get to the crux of what we're talking about today. And it will be most welcome, I'm sure, to everybody, because when Leo Varadkar the other night on the Claire Burns show, when he wanted to kick the idea of zero COVID to touch and saying it's not possible, the one thing he did cite, Julian, was what we're sharing an island, we have Northern Ireland, we have no control, and that was a kind of given as a reason why we should quit on the whole project. It didn't make sense, but we'll be looking forward greatly and are looking forward greatly to your contribution. So thank you very much. Away you go.
Thank you, Eamon. So yeah, I'll say a few words about that. There hasn't been much discussion about the border and COVID, apart from the last 48 hours, I would say, in the public domain. People have said a lot that the border makes everything impossible, but discussion, very, very, very little, which is quite revealing in itself. So I'll start by saying a few general points about that so you can see where I'm coming from, and that will frame the discussion. And then I'll show you a few maps, which are examples. All right, so that's how I'll do it. The first thing to say is that at ISAG, we all recognize, just like probably most of the population, the best solution is not to have a border management approach. It's to have a one island cooperation or some kind of coordination north and south. It would be so much easier. I would not have had to spend 2 months calling Australia and everybody about this border plan that I'll talk about, right? The difference with maybe others is that personally, I don't believe that you should put all your eggs in one basket, in the basket of North-South cooperation. It may happen too late. It may not happen. It may not happen as much as you'd like. Therefore, you need a plan B, or what Thomas Ryan sometimes calls the silver medal. So that's what I'm talking about, recognizing that it's a silver medal kind of prize. What I'm basing this on is conversations with mostly Australian civil servants who have gone to battle with COVID, who have managed the borders there and have won. And they've advised me on this. Members of the Garda in Ireland as well, right? So that's where it's from, and conversations with other people as well. The one thing I'll say, political will is very important here. So my goal is to present a plan that makes sense, is feasible in outline, in principle, if there's a political will. No political will, we're going nowhere. There's no way. So that's important to make a distinction between that. To show you a little anecdote, I don't like usually to have anecdotes, but to show you what a political will is, when I called Australia, I called many times, but I once called the general info number in New South Wales at 7 a.m. on a Sunday for them. I thought nobody's ever going to pick up that phone, and if they do, it'll be a wrong number or something. So I said, hi, hello, I'm from ISAG. I'm sure you've never heard about it. I'm from Ireland. I have questions about the border and your border bubbles, a lot of technical questions. Person said, oh, no problem, I transfer you to our border unit. So, oh my God, border unit, 7 a.m. in the morning, it's on Sunday. So pick up the phone. Hi, the woman answers me. I said, I have about 12, 15 questions about how your bubbles work. Oh, no problem, you can ask them one by one. We spent about an hour. All my questions were answered very clearly. I try to reach sometimes politicians across the road here. It takes me 2 months. I can't even reach their PA, right? That's a very, very, very clear difference. It's day and night. And in Australia, they're waiting for a call from Ireland and elsewhere. They've won the battle and they're there. So that's an important thing. Now, the thing I'll say, again, another point, border management is actually not so much of a health issue. It's done by the government and police forces. So in Australia, what the doctors said, they said, hey, government, you want to take this under control, you're going to have to manage the border. Now do it. The government said, okay, I have my police forces, I have border agents or whatever, and they did it really well. So it's what we have to focus on, really. It's a matter of implementation. The principles of outbreak management are very simple. I'll get to that quickly. What's a challenge is to implement that in different areas that are all different and have different communities. So you need a national team. If the government says here, I want 100 senior Garda to put their head to this with local leaders, with the HSE, and with people and local councillors on the border, that is entirely different from me just calling Australia and trying to get some kind of plan on a map that I drew just a few days ago to illustrate in the best way. So a lot of things shift with that. Also, border plans vary with the situation and the epidemiology. I cannot present one plan that is good for everything at all time for Ireland. So I'll present 2 or 3 actually to show, depending on where you're close to zero or when your cases all over the place, like now, you need a different plan because the situation is very different. So I'll present the ones that I think are kind of the ones people have in mind, but this is to be adjusted all the time, and you make mistakes and you fix, but you have different strategies. Another point, sorry, that's because again, we haven't had much discussion about this in the media. There's no difference between the border and Cork and Dublin and Athlone or anything. They're all places. So you have to tackle this COVID geographically. Every space, every area has features that may be disadvantages, maybe advantages, depending on what the situation is, and you have to deal with them. Some places will reach zero COVID first, others last. That's not a reason not to do anything. It's not like if everybody is going to be the same. In geography, one thing people always talk about is places are different. It's very simple, but it's very true. If you ask me to put my money on one county that will reach zero, I'd say Kerry. Last, I'd say Dublin, not the border. I'd say Dublin. It's a big city. It's difficult. So that's what we have to keep in mind. The last thing is that a lot of the questions that I'll get, I assume, is about, I work in construction, what about this? I work as a GP, what about this? I work as a, whatever, what about this? All of those plans revolve around having good sectoral industrial agreements. You have to talk to the construction industry and make a plan that works well for them. You have to talk to the health people, make a plan for them. And a little anecdote again, there's a police chief in Australia who told me, my God, you cannot believe how much I learned about the honeybee trade. I'm so sick of it. I'll never buy honey anymore, because at that place, at that time, it was really important. So that clears up a lot of the questions that people have, I think. And it also shows that nobody can answer all those questions in detail, because it depends on what's going on the ground, the dairy industry or whatever. Okay, so that being said, that's for the general principles. Now, before I show the first map, we already have a border plan right now. Level 5 for everybody, 5-kilometer radius, could be even 2 kilometers, it could be 1 kilometer. That's a very big, tight border plan. Nobody moves, right? So you could do that for the next 9 months, for the next year, until everything is fine with the vaccines. That's a border plan, that's a job done. But it's too restrictive, right? So sometimes people, and when I present the plan I'm going to show you, people say, but my God, you can't block people from going there and there. We're all Irish, we have to move. But then they accept the level 5 restrictions, which is 5-kilometer radius, which are much more stringent. So it's important to see that there's an extreme in the level 5 restrictions we have now. And the plans I'm presenting is that when the situation becomes better, when their cases are lower, you want to open it up, but you want to still contain things. So it's in that optic that the maps should be seen. So share my screen, hopefully it'll work. Okay, that's the first border plan. It's not the one I recommend now. This is the one that is copied on what Australia has now. It's the bubble system, okay? It works really well, if implemented well, when there's very low cases in the border region, all right? So it might be a plan that's good down the line, or would have been good this summer, for example, when we had low cases. So if you look at the red line, it's the border, and the blue lines, north and south. In between the blue lines and the red line, those are the bubbles. So you can have a bubble on the north and a bubble on the south. So that's what they do in Australia again. It works by, I just did it by hand, but it works by zip code for them. So they put all the zip codes there that are included in the bubble and those that are not, and they shade them. And you can go online and it's all well explained, all the procedure to where you are living and where you can go. So you have a system of permits which allow certain people to move to certain places. So within the bubble, north or south, you can go anywhere. If you're north, you can go south. If you're south, you can go north. within the bubble. If you're outside the bubble in Belfast or in Dublin, then you can only go so far as the red line, right? So you cannot cross completely. And there's very different combinations. As you can see, there's 4 zones here, the 2 bubbles and the 2 zones outside. So each zone can go to 3 other zones. You have about 12 combinations of travel. And you can have those combinations in a stiff way, which is restrictive, or in a looser way. So that will be more of a porous border bubble. That depends on the situation, depends on what your political will is, depends on everything like that, right? So that would be one aspect. That's what people sometimes have in mind with the permit system. You know, you live there, you have a permit, you apply online for your permit. If you have a special trip, you can apply for a special permit. There is exemptions and all that stuff. But at the moment, you cannot use this in Ireland because we have too many cases. So the cases would eventually spread really quickly. Let's say they're in the north, they would spread south and vice versa. You need something that's more solid and more to contain in a more significant way, okay? But as I said, we can use level 5 all over the place, but we can also have something kind of in between. So that map here is to show that, this is of course Cork, not the border, is to show that when, imagine the whole island is at 0 COVID, but there is one place on the island which is full of COVID, okay? In this case, Cork Kerry, the red area. You call that a red zone. So you don't have a choice, it's called the red zone. The last thing you want is people living in there to get out of that zone and infect the whole country. So it's very logical. You call that a red zone, and you put checkpoints all along the red zone between the red and the blue here. So we have Garda checkpoints, or I say Garda, it could be Garda with the HSC, it could be whatever works in the area. So the goal is to contain that. So what you do, usually you'll put a buffer zone, which is in blue here. So that's a zone where people who live in there, they're kind of in between. They can go in the red zone, but not in the yellow and zone and beyond that. Or you could say the blue zone people can go in the yellow zone and beyond, but not in the red zone. So you'll have to decide that based on local circumstances and what works, and depending on cross-border flows and all that. There's many ways that's possible. And then you have a yellow zone, which is called a sentinel zone. That sentinel zone is a place where you test for cases that would have spilled over. So you can do that through sewage testing, through mobile phone data, through GP testing traditionally. It's whatever you have, right? So in Australia, they have different levels of testing for their sentinel zones if they had to use them. So it's whatever works. You can see probably here at the east part, there's the red zone touching the yellow zone directly. There's no buffer zone there. That's because, well, there's 2 reasons. One is that when I use the local electoral area, it doesn't allow me to do anything. But you could also have a stiff line instead of a buffer zone. If you're confident that you can block traffic pretty well, there's no need for a buffer zone because maybe there's a national park there, a big lake, a big forest. You kind of look for those geographical features. You could put a stiff line there, so you'll have people go through, but you're confident that it's going to be fine. So you can have that as well. Now, next map is for Dublin. Like I said, we talk about the border a lot, but if I had to bet on one area that would be last to reach 0 COVID, I wouldn't bet on the border. I'd bet on Dublin. It's a big city. And as you can see, we can have the same kind of arguments with Dublin. Oh, it's really well connected internationally. The infections will always come. The same thing as with the north. So you can have the same system there. Red zone, you can't get out of Dublin. You know, you just can't. And then you have the Wicklow Mountains here south. So maybe you can have a stiff line because there's not exactly a big movement there. So
Great.
you can do that there for Dublin. And again, the map here follows local electoral areas, but maybe a better way is to follow commuting patterns, which Paul, who spoke first, has data on this. That remains to be determined as well, depending on what works and what doesn't work. So that's for Dublin. Now, you can do that for anywhere on the island. And then we get to the map you all wanted to see about the north, right? So it's an application of this. Again, let's start from the top. Red zone 1, red zone 2, red zone 3 in Cavan, red zone 4, and red zone 5. Okay, so here the assumption, again, which may be right or wrong, depends on the situation, but the question people always ask is, what do we do if Ireland is doing well and then the north is not doing well? So they'll, it all spill over. So you need some kind of containment strategy. Again, if the situation is different, that map will have to be modified. All right. So what we do here is that we have, let's take red zone 4, Monaghan area there. You have the red zone there, and people in that county cannot get out as a general rule. Just pure logic. If you get out, you're going to infect the rest of the country. So there's no point doing anything. Now, where do you put your checkpoints? Assuming we're going on a county basis, if you don't have to, you can be even stiffer and doing intra-county, but you can put them in various places. You can put them on the actual border, right? And you do what you can. And then there's border communities, as we all know, there's a lot of traffic. You'll have essential cross-border, and you'll have non-essential. So you can restrict non-essential. And you'll have that reducing traffic there. And then you can have checkpoints on the southern line of the county as well. So if you cannot restrict the entry into the northern, into the actual border, and it keeps coming in and Monaghan gets infected, you need a containment line, a stiff line at the bottom of Monaghan on the south side, right? And again, you can have, I only drew 2 lines here, but you can have many other lines within the county, right? So when you go below that south, you can see I put a black line around Cavan. That's just to illustrate that in some areas where you think that there's not too much cross-border, cross-zone movement, you could have a stiff line, and you don't need a buffer zone because you're confident that it's enough to have one line of checkpoints and we're fine. We don't have to have that graduated type of approach. Places where there's more traffic, like around Dundalk, and you'll need a buffer zone because it's more graduated. You couldn't just handle all of that traffic. I'll say a last word. Well, you have also on the, around Sligo, the yellow lines, which are a bit pale, would be your sentinel zone. So you would test either sewage or whatever you have to see if it's spilling over. And again, to emphasize that, I put it on a county basis because there's a debate and those people who think about that. Is it easier to go with the county lines that people understand, or is it better to go with the commuting pattern lines that people don't know but make more sense logically? Again, that depends on the local circumstances, the public messaging as well, how you can explain that. Well, let's go to just a final word for Donegal. You see, the way I've done Donegal here is that Letterkenny area will be a red zone. Again, we're assuming that it's infected and it's coming from the north and all that. Donegal is not an easy one, right? Because it's really integrated with the north and it's joined to the south by a small area. So what you want is that there's no strategy that will say, okay, this will remove all infections in Donegal and that's it, everybody is fine. What you want is that if there is a red zone in Letterkenny, for example, you don't want that to spread southwards because that's what management and containment is. Therefore, I put 2 buffer zones there and another red zone around Donegal town. So there's a lot of restrictions. So for people to get from, let's say, Letterkenny and the infections to go down to Cork or whatever, you'll have a lot of obstacles to go through. Now, again, people who know the areas really, really well, all their, back streets and everything, you could always modify that. But the principle, that's what matters here. You want to have red zones surrounded by buffer zones or stiff lines. And when there's more infections, you have to stiffen those lines. And when there's fewer infections, then you can relax restrictions. And we can talk later about all I think a big question people have from what I have, discussions I have on social media or elsewhere, is what do you do for special categories of workers? You can always have all the exceptions you like, but as we know, if you have more exceptions, too many exceptions, it'll take more time. If you have fewer exceptions and you really reduce traffic, then you'll have to have more coordination and engagement with employers and find a good way to work with that. So if you don't do that, it's really hard then to just rely entirely on the guards to police everybody. But if you have good sectoral agreements, then that really reduces the problem. So that's what I had to say.
Okay, thank you very much, Julian. I'm sure there will be questions there, because watching it, the first thing that struck me is the mobilization and the manpower to implement is the first big question you have to answer. And the first big question your critics will pose. And it's a particularly Irish thing. Mobilization and organization and implementation is much more difficult than talking. That's a generalization about the nation. But thank you very much, Julian, for that. We're very grateful to you. Now, the next person to speak is Sam McConkey. He's almost as full of stardust as Tomas Ryan. He's the Associate Professor and Head of the Department of International Health and Tropical Medicine at the Royal College of Surgeons. He's a member of ISAG. And Sam is a Northerner, and he's going to talk about North-South cooperation from a public health perspective. And I should just say that doing a little bit of research this morning, I discovered that the Irish government and the Northern Executive had signed a memorandum of understanding on April 7th last year to cooperate in fighting the virus. That's just a bit of background. I don't recall it happening. So Sam, if you're ready to speak, we're ready to listen.
Thanks. Thanks very much, Eamon. I'm certainly an Ulster man, but I grew up in Monaghan, and my mother was from the north, my father from the south. She was a teacher, so she thought I should be born in the north because the healthcare was better. And then when I went to primary school, she took me across the border every morning through these huge 2-meter deep craters that the British Army had blown in all the little roads. We drove down into it around the side, and then we pushed the car out into the north in the morning and back the other way. So I feel like I have a foot on both sides, which is quite a challenge given we're talking about controlling border movement. My background's in healthcare. I'm really a practical doctor, and this whole last year seems like a bit of a very strange one. Obviously, it's in health systems and vaccines in the past. In healthcare, as a leader, you really want to build consensus. You want to identify potential sources of conflict early and try and resolve them through negotiation and through consensus building. And what I've realized is that in law and politics, that's sort of the opposite, that it grows on divisiveness, on conflict, on people taking strong positions. And unfortunately, that's not serving us well in the middle of this pandemic. So I'm going to talk for maybe just 5 minutes about how I see people could maybe work together in new ways and better to deal with this, essentially a health emergency, where I would put to you that our processes of political conflict and fighting and opposition and government and so on don't work so well when we have this type of common problem of a healthcare nature. Because what we need is actually building trust, building compromises. It's more like the wonderful Irish diplomats and the Department of Foreign Affairs who went around the EU 27 capitals over the last 3 or 4 years and encouraged them to work with us on Brexit, and did a phenomenally good job and built a European Union compromise of 27 countries on how we had a common shared agenda in approaching this crisis that was Brexit. And that was very successful. Now we maybe need those same diplomats to help us to build consensus with the folk in Northern Ireland, both orange and green, perhaps also then a 2-island approach in Scotland, Wales and England as well, because what we need is diplomatic consensus building where compromise becomes the thing we're looking for. It's not a bad word. It's actually negotiated compromise, I think will be the only way forward. It's the challenge of working with people who are different from us and who we may disagree profoundly with politically in some ways, but on realizing we have a common agenda here and we can have limited compromises to fulfill our common agenda and common goals. This is quite challenging because many of our language and words that we use can really irritate people who are different from us. One of the examples I would give in an Irish context, even use the word of nation. Obviously, many of us feel we're a nation here in Ireland, but the reality is that there's more than 1 million people who feel that they're part of a different nation. So talking about the nation of Ireland is almost a challenge. It's a thorn in the side. It's a divisive, politically contentious thing. So in terms of finding negotiated compromising, almost washing out our mouth and finding a new vocabulary is an essential prerequisite to that. Maybe also humbly recognizing, the errors of the past. I think it is the case now, 109 years later, that we can recognize that the issues around, the Ulster Volunteers, the Ulster Covenant, the big issues they had, one was home rule is Rome rule, ruled by the Vatican. And the second one was that if we go into independence, we'll end up with 50 years of poverty and emigration. And of course, now 109 years later, we can obviously see that they were right. With 100 years of hindsight, we now see that those were largely true, but yet that is very rarely acknowledged and spoken openly, that the issues that drove 500,000 people to sign their name and blood on the Ulster Covenant may have actually been very legitimate at the time and were followed through with 50 years of history that showed them to be true. Now, of course, the good news is that we've moved on in this country from those, and those are no longer issues. We're an independent and wealthy country and open to the world and so on. So, but having that discussion with people who are profoundly different from ourselves is a challenging one, and a little bit of it's about recognizing the truth. So this in my view is a challenge of political will and political cooperation. I think I see it analogous to what Michael Martin did a number of years ago for the smoking ban. This needs a dramatic, first in the world, first in Europe, leadership crisis. It's a little bit like what we did with taxing plastic bags, or even to go back further, the mother and child scheme of Noel Brown back in the 1950s, which I realize led to fallen government and wasn't as successful at that time. But now we all take children's allowance for granted, and it's become part of our normal world. So I think there's a need for this consensus building to support the trust that's needed for this dramatic political leadership if we're going to move forward on this.
Okay, Sam, thank you very much indeed for that contribution. The next speaker is Nessa Cronin. Nessa is a lecturer in Irish Studies at the Centre for Irish Studies and Associate Director of the Moore Institute at NUI Galway, and she is a member of the Independent Scientific Advocacy Group. She's going to talk to us about common ground and the politics of possibility. So if you're ready, Nessa.
Yeah, great, thanks.
It's all
thanks
yours.
a million, Eamon. And I'm going to probably pick up a little bit of where Sam left off there. So I'm going to start with a few general comments about all of the discussions I think that have been accelerating in the last week in particular, about our relationship to ourselves, but our relationship to our neighbours, both above and beyond the border, but also across on the different islands as well. And then I'm going to finish then with a very brief commentary on the border as a sieve. And I'll finish up then, because I know we'll be moving on to questions and answers. And I know there's lots of questions coming in, so I don't want to hold you all to ransom for my observations. So first of all, Pat Leahy in the Irish Times wrote this morning, and he said that COVID-19 punishes drift and uncertainty. And he finishes his article by saying, what is the plan that's going to happen after the 5th of March? Many people in ISAG and others have argued that the short-term thinking that we've been living with since March 2020, and what our guest speaker Sam called misery level mitigation, is not really a positive solution for a long-term problem like we're experiencing now. And I've been waiting all day to say this, Eamon, as well. So I had Roy Keane in my head, and the mantra is, of course, fail to prepare and prepare.
Be on your head or in it. Dangerous
Poor
stuff.
woman, I had to get it in. I had to get it in.
Okay.
So, I mean, people have been arguing for this, and there is absolutely an opportunity here for Micheál Martin and others to really lead forward, not just in Ireland or in the islands in this part of the world, but indeed in Europe with more proactive leadership rather than reactive crisis management strategies, where we've seen people looking in the rear view mirror all the time without looking at the truck that's barreling down in front of us. And whether it's the truck of the challenges that are there with vaccine rollout, the truck that might be coming towards us in terms of a higher transmissibility of the disease, or even more worryingly, a new importation of a variant that might actually escape vaccine control. These are all very, very real worries and concerns of ordinary people in Ireland. And I think all of the opinion polls from the Daily Mail to the journal.ie to Ireland Thinks have shown that about 90 to 91% of the population are really concerned about the real border, which is the international border in Ireland, and how to prevent the island of Ireland being reseeded. So I have some suggestions that I'd like to offer, and this is both as my role as an educator, but also as a mother. Since March 2020, we've all been juggling these roles, and I think it's in terms of also looking at the kinds of messages that we hear from public health expertise internationally as well. So the first thing is be honest with the people. I think of the coffee cups, be frank and honest. We've heard a lot of people talking about, I must be frank with you now, but you must really be frank with people and be absolutely honest. And to say, love us, sue us, I made a mistake, we're going to learn from it. And Aoife McLysaght has talked about that. We will accept people making mistakes, but we will not accept them making the same mistake twice. Number two, we need to be real. And this is something that happens with any aspect of crisis management, but also dealing with trauma. I know the Irish Times and Roisin Ingle last night, they were speaking with Dr. Edith Eager and her idea of the choice. And the idea that you need to acknowledge the position that you're in, but you need to have both hope, but you also have to have a measure of reality with it. So don't give veiled threats, don't give false promises, but be real with people and they will listen to you and they will continue with your trust. The third thing is to acknowledge, and this is something particularly for the island of Ireland, is we can't go it alone. If one person has COVID, we all have it. If one person has a problem with it, we all have a problem with it. And we've seen how that, with the low cases in the summer, how one thing incrementally spreads, and we all end up in where we are now. The fourth thing I'd suggest is give people a plan. People need to hear that there is a livable roadmap out of level 5, that there is something going to happen positively after the 5th of March. And I think one of the concerns that people have now is that we haven't really heard what that plan is. And there seems to be an absence in communicating that plan. If there is a plan, we'd love to hear about it. But unfortunately, we haven't really heard very much about what that plan or what that strategy is after the 5th of March. Some observations then on language, and again Sam has mentioned about we need to be very sensitive and very careful about the use of language. There were 1 or 2 words that were used in particular by the Taoiseach on the Claire Byrne show earlier this week. One was the reference to the hotels as detention centres. I know from my friends and colleagues that work and that are working with people in direct provision centres, they found that very, very concerning and very upsetting. And indeed, the idea of a particular kind of hotel being seen or being demarcated, something like Guantanamo Bay or a detention centre, I think was really, really upsetting to a lot of people. So we need to be very careful about our language when we're communicating to the public. Also, the people, I think, are getting a little bit concerned about a language of passivity that seems to have crept in a little bit as well. And we need to be very careful about a politics of impossibility. We talked about this a bit last week in our public webinar. And I think people need to hear about a politics of possibility, to look at what we have done successfully before. So we have successfully managed the border in 2001 with foot and mouth disease. We have successfully eradicated eliminated other kinds of transmissible diseases. And I think we need to hear more about that so people can feel that they are empowered to actually get on and move on in their lives in a very appropriate way. So the rhetoric and the reality need to be more carefully aligned. And I think in particular, this idea of that quarantine at home is equated to a particular kind of quarantine in a hotel. I think it was Colin McQuillis said, this just sounds more like self-isolation. So again, there's this slippage in the language and the rhetoric. And in terms of a public health crisis, you have to be absolutely clear, absolutely rigorous, and absolutely on key with public health notifications and language when communicating to the public as well too. Finally, this is a final observation. Politics is about the art of negotiation and the art of compromise. And we have been the beneficiaries, my generation has been the beneficiaries of that fantastic art of compromise and that fantastic art of negotiation since the Good Friday Agreement in 1998. Thomas Ryan has argued before that for many of people of my generation, and indeed for my students that I teach, the troubles are very much in the past. And this kind of language of we can't do it, it's impossible, oh, what about this? That doesn't speak to the Ireland that my students live in. The Ireland my students live in is the Ireland of the 2 referenda in the past, the Ireland of positivity, the Ireland of we can make a change, we can make it better, and we can create a better future for everybody. So that language of negativity, that language of impossibility, and that language of we can't do it doesn't seem to have any resonance, I don't think, for people maybe of my generation, in particular for my students as well. And I would even go further than that to say, I actually can't accept that. I don't think it's an acceptable way of doing politics or an acceptable way of managing a pandemic in Ireland at the moment. And I think we need to really push forward and move in a way of what Roisin Shortall had argued for. We need to be more brave, and we need to be more ambitious now in different ways, I think, as well. Finally, there has been a lot of discussion about sieves. I know Gabriel Scally mentioned a sieve in one of his comments on 6.1, and as well Leo Varadkar had discussed the idea of the border is a sieve. So whatever about the airports and the ports, we can't, there's no point worrying about them because the border is going to let everything leaking through anyway. And then I think Micheál McGrath was on the Tonight Show last night, and he also made that reference to the border as sieve. So when I was just hearing about the sieve, I was getting very excited because, I was kind of thinking, oh, they're going to throw the kitchen sink at this now. They're going to get everything out. We're going to throw everything at it and we're going to deal with it. So, but then I was thinking, no, actually, they don't understand how sieves work. So I have brought in a sieve. And I thought, as a researcher, I said the best thing I can do is find out how do sieves work. Indeed, if you want to put soup into something, what happens? So the argument that Tony Holohan and Neffet were saying is that when you bring the PCR test in, you might capture about 60% of the test. You might capture 60% of the virus, but the other 40% may escape. So if you put it into the sieve, you'll get the 60%, 40% will come out, and you have escape. Okay, but the problem is the real sieve in many ways is around the island of Ireland, and it is in our airports and it is in our ports. And so when we do get to the point where community transmission is low, we can't afford to be using this anymore. And in a way, we need to use something a little bit stronger and a little bit braver and a little bit more ambitious, I think, rather than using the sieve. Finally, I'm going to finish on the language of possibility, and because this is in discussions of our friends and families and neighbours in Northern Ireland, I will end with a few lines of Seamus Heaney, and it's something I give to my students as well too when they say, oh, I can't do my essay, I can't think about this, I can't think about my exams, I can't think about my job interview, and I always give them a couple of lines of a quote from a poem, and I'll finish off with that then, Eamon. So it's from his poem, The Settle Bed. Imagine a dower of settle beds tumbled from heaven like some nonsensical vengeance come on the people. Then learn from that harmless barrage that whatever is given can always be reimagined, however foursquare, plank thick, hull stupid, and out of its time it happens to be. So that's the way things are. They can always be reimagined. Thank you very much, Eamon.
Okay, thank you very much, Nessa, for that contribution. We're very grateful for it. We are going to now continue with questions and answers. Just an observation. It is very, very clear, and it was very welcome to see Alan Kelly in particular join this webinar, and I hope stay and listen. The Independent Scientific Advocacy Group has persuaded the public, which is persuaded, and Sinn Féin, the Labour Party led by Alan Kelly, are also Roisin Shortall and the Social Democrats, and many people in the media. What we saw yesterday from the government was weak, indecisive, evasive, and will only add to our troubles. So The campaign to persuade needs to continue. And yesterday was a very, very bad day for what the Independent Scientific Advocacy Group has been advocating. Yesterday was a bad day. And that's where we are. But the contributions this morning are interesting and very helpful. And if anyone has questions, Gabriel Scally was in earlier. And again, if you listen to him in his media interviews, he is rigorous, he is to the point, and he knows what we need to do. Most people do know what we need to do. I think Nessa referred to 91% of the public who know what needs to be done here, and that equivocation and cowardice won't get us anywhere. And that's what this government is offering us at the moment, I'm afraid. So if anyone has questions, please. Pardon? Oh, the questions are here. Okay. Right. The one right in front of me is Mick Brown. Mick's question is, and it's for anyone to take. Perhaps Sam McConkey, you might like to take it. Is there any decent method for estimating the capability of a government to implement such a plan? And I think that's a good question, Mick, because the logistics of, say, what Julian outlined, and it was very, very interesting the way the logistics of that sound a bit daunting. And they allow, and Leo Varadkar, shall we say, on Monday night with Claire Byrne, they allow politicians who want to slip out, come on, you know, let's be practical. Yeah. So, well, that's what they're saying. I mean, the Australians and New Zealand, it didn't come easily.
Yeah. So I think it's really important that, almost contrary to what Leo Varadkar said on Claire Byrne, to recognize, as Tomas mentioned, that 1.5 billion people out of the 8 billion people on the earth are already achieved this.
Yes.
And many of them live in countries like Taiwan and New Zealand and Australia, where they actually had realized that SARS-1 and an epidemic coronavirus was a real threat to public health in the future. And they already had a well worked out government plan for dealing with SARS-1 on the shelf, ready to start when they saw it coming. We unfortunately did not have a SARS-1 plan on the shelf ready to start. We were using an old influenza pandemic plan, which unfortunately is a different virus and needs a different response. So we are a bit behind. So they have succeeded, and the countries in Asia that have really gone at it have done well. There's some other countries, obviously in Europe, Greenland, Faroe Islands, Jersey and Guernsey. I think it's interesting, Jersey and Guernsey, one has succeeded and one hasn't. So I think it is true that while we try, you can't be 100% guaranteed that it will be effective. And as the experience from Australia is there, it can always be reintroduced. So you need a way of dealing with epidemic control that continues if it's reintroduced. So I think that's the best I can say.
Is there anybody else who would like to address that question of logistics, mobilization? And Julian, by all means, yes.
Well, just, I would say, never underestimate the power of a single declaration from the top at the government.
Yes.
72 hours ago, I was always seen as this kind of a complete outlier with a border plan. Now, in the last 48 hours, everybody's talking about it. Now it's much easier for me to give a presentation like this, right? Yes. So there's nobody who's ever going to convince me that when you mobilize all the resources of a modern state in Europe, you cannot manage a border and some checkpoints. If you can close all the pubs in this country and all the schools for months, you can manage a border to, not perfectly, that's never been the point for anybody, but to a point that it makes it very worthwhile. Of course, people in Australia were telling me, depending on the states there, it depends what your background is. Some states have been to battle, that's their words they were using, for other type of epidemics. We were really ready. Others have fought bushfires or whatever. They were less ready, but they made it work. So in Ireland, of course, I don't know exactly, the level, how you could measure it, but it's not that we're starting from, like a big experience with pandemic or whatever. But if you make it happen, you make it happen. We don't live in a country that's poor and that's, under-resourced or anything like that. So it just needs to have a small move from the top, and people will put their head to it and make it happen.
Okay, a question for Tomas from, well, I'm condensing a number of questions. How how can we help to pressure the government to adopt the zero COVID strategy? And I know the zero COVID strategy can be a bit of an albatross. It's aggressive suppression with the objective of zero. You don't have to get to zero. If Thomas is there, I'd like to ask him. A number of people are there wondering, practically, how can we mobilize? How can we man this? How can we have, in terms of the border in particular, the kind of regime that Julian envisages?
Thank you, Eamon. I'm not an expert on politics, obviously. Now that we have the Social Democrats, Labour, People Before Profit Rise, and to a large extent Sinn Féin supporting what can be called aggressive suppression policies, and notable dissenters in all of the main three government parties, those are the people who are going to be best placed to answer that question. From my perspective, it's very much like the repeal referendum in some respects, because what you have is a lot of citizens wanting something that is not really represented by conventional politics, by business as usual in Ireland. The ISAG in general, we're contacted a lot by citizens and by small business owners who really want to express that they are strongly behind a zero COVID policy. And these are vintners, these are hoteliers, these are restaurateurs, and all kinds of people who don't think that what the lobby organizations are saying for them, that we need to open up the economy, is the right thing to do. They recognize that the way of dealing with this is to get rid of the virus. And they try to contact their TDs and their councillors to an extent, but they don't feel like they're having an effect. And what we need is an all of society movement towards this. And now it is clear in the past week that most of Ireland by far want a zero COVID strategy. It doesn't mean it's going to be perfect, but we need a strategy that is comprehensive, that does everything we can to attain a zero COVID situation. And when we look at the politics of this internationally, going from the United States to New Zealand, and the differences there, out of the 1.5 billion people who live under a zero COVID situation, there's a huge diversity of countries there, huge diversity of political systems, huge diversity of advantages geographically and technically. What the common feature is, they all made a choice. And they suppressed the virus to zero community transmission. They stopped new cases coming in, and they have a response system in place so that you can deal with it when it comes, when cases arise. And to say zero COVID is unrealistic, it's like saying, well, is zero fire unrealistic? You know, yes, it is, but it doesn't have to be perfect all the time. You know, we don't have a living with fires policy. The fire brigade puts out a fire when it happens. That's what a zero COVID policy is, and it should be seen as entirely practical. Now, if you look at the United States, it's almost clear to say that if they had had a different leadership situation, that they would be in an entirely different situation. And by proxy, we would be in an entirely different situation because the expectations we would put on ourselves would have been different. Similar thing to a certain extent could be said about how the United Kingdom has affected what we think is acceptable in this pandemic. But yet New Zealand went in an entirely different direction, which was by and large possible for us here. So it seems to me that while successful countries all have something in common, unsuccessful countries all fail for their own reasons, just like unhappy families are all unhappy for their own reasons. And I think that the reason that we've failed is because we're too polite about expecting a certain degree of efficacy from the government, and too polite in saying what we really think and what we really need to be happening at this time. It's been very encouraging that the opposition parties have come out strongly for zero COVID, I would say including Sinn Féin, because what Sinn Féin is asking for will lead to an aggressive suppression towards zero policy. We've seen very notable dissent in all three government parties. Many Green Party councillors have come out for zero COVID. Senator Vincent Martin gave a very impressive oration in the Seanad yesterday for zero COVID. At least one Fianna Fáil TD has come out for zero COVID. And the MEP and extremely experienced politician, Francis Fitzgerald, wrote an excellent piece on Sunday explaining why we absolutely need mandatory hotel quarantine. So I think we're going to see some progressive movement within all of the government parties towards a zero COVID situation. Now, we can't comment on how to do politics. We're an independent scientific advocacy group. But what we can say is that if scientists, the scientific community was to adopt the same strategy, that same attitude, as we're hearing from some politicians right now, then we could expect a vaccine in 6 or 7 years' time, maybe.
Okay, can I interrupt you, Tomas, there, just to ask Dr. Gabriel Scally a question. Dr. Scally, you're immensely experienced and immensely impressive when you're asked questions. I saw you twice on television this week. We have a situation here, if you could apply not your medical brain, but the other part of it, the other side of it. We have 91% of the people in this country, thanks to media exposure of the arguments, and they see clearly what needs to be done, what is required. We have a growing number of senior politicians, substantial figures like Alan Kelly, the leader of the Labour Party, a good example, and the whole of the Sinn Féin. We have some media, substantial media figures now also accepting the argument that Tomas and others in the advocacy group have been making for some time. So winning on all fronts, and yet the response as it manifested itself in yesterday's measures, quote unquote, that were announced is really, really pathetic. How can we overcome that problem, do you think?
Well, first of all, can I say, I think the job that's being done by my colleagues in ISAG in shifting that public opinion has been magnificent, just absolutely magnificent. And I think that the people have a phenomenal power if they choose to use it. When you have that unity of purpose and unity of direction set by the people, the politicians cannot stand in its way. So there is a need, I think, to mobilize and mobilize people to contact their TDs and tell the TDs how many, who they know has died, and from what is a preventable disease, and how many more. Ask how many more are you prepared to see dying, and the TDs need to be told by their constituents what their constituents want them to do. The people of this country, North and South, because the same thing is the position in the North. I'm very clear about that. And politics is shifting and moving there. The will of the people, the politicians need to obey the will of the people on this. It's the people who are dying. One of the things that if you look at who's dying in this pandemic, and it's crystal clear in the UK, the people who are dying are people in the most deprived communities, the people in overcrowded housing, people from ethnic minorities. It's not politicians. It's not wealthy businessmen. It's not the sort of people I find myself arguing with, like Lord Sumption. It's not them at all. It's ordinary people, and often in the most deprived circumstances, who are suffering. And it's ordinary people and children of ordinary families that are suffering, being deprived of their education because of this false dichotomy that the politicians have drawn between economy and health. You can't have healthy high streets if you've got sick people in your back streets. You just can't. It doesn't work that way. And people should be contacting their TDs and their councillors and anyone in those political parties and telling them this is wrong. And the politicians need to wake up and smell the coffee here, because if we go on like this, we're going to be looking back on this. I mean, this is the most cataclysmic event in the country's history for such a long time. And we're going to be looking back on it, and we are going to be seeing politicians who were tested and found wanting. And people will express their views in the ballot box if they don't listen to the people.
I think you made the point on television the other night that we have lost almost as many people as we lost in the Troubles.
Oh, more, Eamon. We've lost considerably more now.
So that is the scale, if you like, of the political challenge.
It is, and we need the same statesmen and stateswomen to step forward. You know, the Mo Molums and Bill Clintons, John Humes, Tony Blair's, to step forward and paint the picture of how we're going to solve this problem on this island together. And as I've often said, the politicians need to leave behind their prejudices and their long-held policy positions on the Constitution or whatever it is, and just deal with this virus and stop playing political games with people's lives.
Okay, thank you very much, Dr. Scally. Professor Anthony Staines, is he there? Are you there, Anthony? No, maybe Simone.
Yeah. Sorry, Simone, go ahead.
Oh, so are you there, Anthony?
I am.
I just want to ask you the same question I put to Dr. Scally about we seem to be, or well, Tomas and your colleagues and you indeed, seem to be winning the argument in a big way with the public, certainly the media to a large extent, and also with significant political figures. Alan Kelly, I would say, one of them in particular. How is that advantage best pressed home to a tangible effect the next time the government is looking around for measures? I mean, and can I ask you if you agree that what was announced yesterday was not very encouraging?
What was announced yesterday is not sufficient. It is a step in the right direction, but it's a step that won't work. So I think what we have to do is to keep engaging with the government, because at the end of the day, this decision is made by 15 people at the cabinet table and by about 20 civil servants. And trying to engage with those groups, we've reached out to most of them. We've reached out to NEFIT. We've shared our materials with them. We've met various members of that group out of the public gaze. We're trying to have a positive conversation with them about what can be done. What are their concerns and fears? Pascal Donahue tweeted this morning a tweet about the total cost so far of COVID-19, which is absolutely horrifying. I had not realized how large the numbers were. And I think reaching back on that level, reaching back and saying, here are the costs. This is what we're spending right now. This is how much it will cost to do something effective about this will be very important. Something that is very important for many TDs in particular. I had a conversation with a government TD only yesterday about exactly this, is small employers in rural areas and in small towns. A very large part of the employment in our economy is in small companies, which might employ 5 people, 10 people, 15 people. Many of those companies are running out of cash as we speak. And they view the prospect of nothing really happening till next November with horror, because there will be nothing left. So putting that to the political system, that without serious government action now, without a willingness to undertake certain costs now, that the long-term costs could be devastating. We've seen in small Irish towns, if a business closes, that site can remain empty for a year, 5 years, 10 years. I could take you around fairly prosperous towns in North Cork, and I can show you sites where business closed 25 years ago that have never been reoccupied since. It's very hard to bring jobs and employment back. The big cities will be fine. If I close my restaurant on Mercier Street, somebody else will come along and hire it in a few months' time, a year's time. The jobs will come back. That is not true in rural Ireland. It's not true in small towns. So I think that's the message.
I just want to ask you one question, which perhaps you could briefly answer, Anthony. The same picture, the picture you just painted there of rural Ireland, small town Ireland, is that picture is also being seen by the politicians in that area, which begs the question, why are they not coming to the same conclusion that you and your colleagues in ISAG have come to?
I think they're not putting two and two together. And politicians are not specialists in public health. This is my job. To people like me, this is as obvious as anything. But it's not obvious if you're not knowledgeable to some extent about public health. So it is a matter of explaining it repeatedly to the general public, to politicians, through every avenue to which we have access.
Okay. Aoife McLeod is in the attic with flaky internet. Is there anyone?
I am, yeah.
Is there anyone who can offer assistance? Can I ask you, Aoife, how encouraged or discouraged you were by the measures announced yesterday by the government for the next period in terms of
well, there were certain
quarantine and travel?
There were certain aspects which I found encouraging, which is in the last week or so, this conversation has been pushed to the fore, where government used to dismiss the whole zero COVID idea with less than 3 words before. Now they are being forced to discuss it. And I think, and it's very encouraging to see the various opposition politicians who have been coming forward, supporting the ideas as well, you know, not always adopting the name, but that doesn't matter, but supporting the ideas. The discouraging thing is that what they did yesterday is not going to work. And the fear is that they then think they have done something. It gives maybe false comfort in certain places where people think they might have done something that will achieve anything. So the idea that somebody who has a negative test then can do some kind of quarantine at home, which I'm sure is not even, if you look up the definition of quarantine, it's not going to be that. Those people don't necessarily live alone. They could live with many, flatmates or something. They could live with a family. So that doesn't sound like quarantine at all. And it also perhaps gives false confidence as to what that negative test tells them. They perhaps feel emboldened and they go, well, I'm fine because I tested negative and I can go about and do everything normal. So I think there's a few risks there that it is an insufficient measure, and then the government might think, well, we move on now, we talk about something else. And so that is the discouraging part. But I do take great encouragement from the fact that the conversation is shifting, that I think the public are now realizing that something that we used to be talking about as a hypothetical, they're now living. They see that we're spending more time in lockdown than out of lockdown, that this idea of living with the virus is really dying with the virus. And I think we have to ask the government again and again and again, what are you trying to achieve? They keep saying we're not going for zero COVID. I say, okay, fine. What are you trying to do though? What is your strategy? Because this doesn't look like a strategy. This looks like a mess. So even if they were to say our target is to get to level 1 until the vaccine rollout is complete, you could say that's a defensible position. Okay, so how do you get there? What are you going to do? They have brushed off. They have succeeded in brushing off and not being questioned sufficiently deeply on what it is they're trying to achieve, because they're and that's been a shame, because by saying we're not going for zero, they never say what they are going for. So I think we need to keep pressing, and we are trying to take the momentum. And if you want to ask Eamon, she can talk more about how we're trying to capitalize on the momentum. We see that people are perhaps feeling frustrated. A lot of people want to push forward this zero COVID idea. I see in the comments there, somebody said we'd be out marching on the streets if we could. And we need to get some substitute for marching on the streets. We need a way for people to show their support, because I think the government needs to listen to the people. I was listening to some friends of mine in the UK, and they were complaining that the UK government is just listening to popular opinion and ignoring the science. And I said, hey, I can do better than that. The Irish government is not listening to the science or popular opinion, because both the science and popular opinion are in agreement in this country, and the government is still ignoring it all. So who are they listening to and who are they trying to please? I don't know. It's not at all clear, and there's no clear strategy, which is an enormous frustration.
Okay, can I bring in Simone, George? Simone, should we be marching on the streets? It worked for the water charges.
It did. I think people are water charges levels of angry and grief struck, and they are feeling all of that, and it's totally understandable. But they're doing the right thing by not being in the streets where the virus as it is in the community would be transmitted. But there's very many amazing ways of your voice being heard. And so we've been working on the People's Campaign, which is an ISAG created campaign, and it's called We Can Be Zero. And the website and the social media handles will launch on Monday, which is St. Bridget's Day, first day of spring. And also in honor of a great Irish woman who did many impossible things. And I really think that if there's a critical mass of people, we will create the political will that is absent. I think it's the only thing that is missing in Ireland is the political will to do this. I think we have the capacity, we have the talent to do it, and we understand the social contract very well. We were talking this morning about the smoking ban. If you remember, we all smoked in pubs. The ashtrays were overflowing and our eyes were red, and it was kind of miserable, but it was really normal. And when people came to your house for a party, you put out ashtrays and maybe cigarettes. And then the smoking ban came in, and people didn't try to smoke in pubs. And then they stopped smoking at parties in their own houses. And then even when they were on their own in their own houses, they started to go outside for a cigarette. If Irish people have the reward at the end of this last lockdown, if this lockdown is made our last, and it is done properly, it could be shorter. And then the reward is that we are out, the domestic economy opens, we're able to be together again. And people who've been, I mean, most importantly, no more lives lost to this, but people who've been grieving over the last year. My mum died on the 31st of March last year in St. Vincent's, and I watched her the last 2 weeks of her life over FaceTime on her own. And it was very difficult, but I understood that we were in a crisis and this had to happen. And my mum, who's an incredible woman, would have understood that. But a year on, it is not acceptable that my friend's dad, who has the same cancer that my mum had, is going into hospital on his own without his family beside him, to advocate for him, to translate what the doctors are saying. And God forbid, I mean, hopefully he'll be okay, but that he would not spend the last two weeks of his life like that. No funeral, no family together. It's not good enough. And it's not necessary. What's even more important, I think, is it's not necessary. I really think we can do this. So the People's Campaign, We Can Be Zero, it'll launch on Monday. It'll go out through all the ISAG social media channels, and please join us, sign up, and start using your voice to ask for what you want from government.
Thank you, Simone. Morna O'Hanlon has messaged the panelists, all of them, to say the opposition should form a united front and have a meltdown with the government. I'm not sure what that would involve, and create havoc to push for COVID zero. And it is worth remembering and noting what Simone just said about the smoking ban. The person who introduced the smoking ban, the first politician in the world to enforce it, Minister for Education, for Health rather, was Micheál Martin, who's the present Taoiseach. I would just like to put that point to Professor Gabriel Scally, or Dr. Scally. You are working in England also, of course, at Bristol. And I want to ask you, just in terms of the campaign that ISAG may launch or are launching, it seems to me much more doable here in a small society with more intelligent and less visceral and nasty media to perhaps persuade people of the rightness of this cause.
I think I agree with nearly all of that, Eamon. I mean, You're quite right about Micheál Martin, actually. Micheál Martin's one of my public health heroes, and he was rightly recognized by the World Health Organization for his achievement in that environmental tobacco smoke ban. Phenomenal. And I have the feeling that he's the right man in the right place at the right time to do this, if he can show the same level of instinctive leadership that he did at that time, because it was instinctive, and he made the decision himself and then went about with others getting it through. So it could be done. And I think Ireland is in a perfect place. And not only do I think it can be done in Ireland, but I think it will be fantastic if the people do it. If it's something that's not given to them from above, but if they do it themselves. So having a popular campaign will help, because one of the things that's absolutely missing in England is the local aspect of it, and the government. It's not by accident all you ever see from England is the press conferences from Downing Street, because that's where all of the decisions are made and all the action happens. And it's one of the things that stops them doing things at a local level that they should be doing, like really good testing and tracing. And I think Ireland is in a much better place there. Of course, the public health infrastructure isn't what it should be. Directors of public health and their consultants in public health and their teams are not as well resourced and as well recognized and as well paid as they should be, and they should be given a central role. And at a local level, it would be great to see county councils, for example, taking on some responsibility for their population in trying to help and support the public health effort. And I think all of this could be built up in some of our sporting organizations. You know, just think of the GAA or any of the sporting organizations who have been deprived of the bulk of their local activity all year. What it would mean to them to be back in the stadia again, playing, and the kids back playing, be fantastic. So I think mobilizing people will be extraordinarily good. And I also think if we can get the politicians to work this through north and south as well, not only will it be easier, but it'll also be great in terms of changing a political dynamic across the whole island, I think. So I think the omens are very good, and we just need to press on and get movement and get shifting. And I think we will do that, because I completely agree with my colleagues' analysis of what was announced yesterday. And by the way, what may well be announced by the UK government in an hour's time. I don't think it'll be enough. It won't do the job, but at least it's a movement in the right direction. At least they're admitting that something needs to be done, particularly on the issue of border public health controls on our ports and airports. So I think we've got a fair wind. Let's hope we can bring it home to port.
Tomas, would you like to summarize what you've heard, and perhaps we will end with that?
We should probably bring things to a close, but just to reinforce everything that Gabrielle Scally just said, I think that our politicians right now need to take a long look at not just the next year, but the next 5 years of their political careers. The youth of Ireland, by youth, I'm going to use the word youth broadly, people under 45, we don't really remember the troubles in the same way as politicians who are older than that do. The world has moved on quite a bit. The pandemic is in the present. We can forgive failure. We can't forgive not trying. There isn't evidence that the government has engaged significantly with Stormont. The lack of sharing of contact tracing data is evidence of that. And there is not evidence that the government has ever seriously considered a zero COVID elimination strategy. You know, batting it away in media engagements, or when asked a question in the Oireachtas, that is not considering a serious proposal. We can't find any documents that show they have considered this as a strategy relative to what they've already been doing, because living with the virus has obviously failed. It's also not acceptable, I think, to use NPHET as a mudguard for making this decision. This is not on its own a public health decision. This is an all of society decision. NPHET are there to manage the day-to-day, week-to-week, and month-to-month situation in Ireland. Where are we? Do we need greater restrictions? NPHET don't have the remit to come up with any long-term strategy, including zero COVID, for the reason that they're not elected. Only the government can do that. So we cannot say that because NPHET hasn't advised it, that therefore it's not on the table. It has to come from the top. It has to come from Micheál Martin, and then he has to ask NPHET how to go about doing it.
Okay, thank you, Tomas, and thanks to everybody who participated and who listened and messaged. Many people, many of them anxious for a People's Campaign, Simone, which you might lead. You can be our Richard Boyd Barrett and lead us to the promised land. But I think also, incidentally, an advocate of the campaign. So good luck with everybody. Thanks for participating. And Monday is a big day for you, is it, Tomas, in terms of launching this new element to the campaign?
Yes, this is being led by Simone very much, who's brought
Yeah, for Monday, the 1st of February, St. Bridget's Day, we'll be launching this on social media. So for people to sign up and get involved, it's a virtual place that people can gather and get resources for getting this message out. So whether getting in touch with their team.
Have you engaged with the media to notify them of this, if you like, acceleration of the campaign?
It is on its way. Do you want to have a chat about that, Eamon, afterwards?
Yes, we certainly, well, I mean, we'll do it on the stand for sure on our podcast. But if you engage with newspapers, RTE, Virgin, it is a good way. And you have people, you know, like Tomas and Gabriel, Dr. Scally, Dr. McConkie, you have kind of people who are available to, you know, and that's been a big part of, I mean, Tomas's performance on Monday on the Claire Byrne show, and I'm not making a joke now, I'm making a point, is invaluable. The support of Dr. Scally is invaluable, you know, and because that's where the public is principally engaging with articulate and decisive and passionate people who want to make this case to the Irish people. And that's where you make your case to the Irish people. And the politicians will soon follow, you know. And if you get Alan Kelly dipping in, I mean, he's a bruiser. He's the leader of the Labour Party, though. And if he starts getting up in Dáil Éireann and embarrassing ministers with, you know, good, strong questions, that is a gain for your cause, a big gain.
Eamon, the plan is to lead the way civil society has done before in Ireland. I know Francis Fitzgerald was on this call. I worked with Francis Fitzgerald on what is now the new Domestic Violence Act. We've a crime of coercive control in Ireland, which we didn't have before, and that was led by her and senators and the grassroots movement, domestic violence movement in Ireland. So we have incredible capacity and skill in Ireland to do this. And if we all get together, we'll create the political will in government to do it. And then we will help them complete it. And we will all have the reward of being out after a short and effective lockdown, hopefully into zero COVID Ireland, and we can all get back to living. And really looking forward to that. So on Monday, that will go out to the media, but most importantly to the people we need to gather with ISAG to say that this is what we want.
Okay, the campaign, for anyone listening who doesn't know, is called We Can Be Zero. Thank you all for participating. I hope it was a satisfactory experience, and that's all I have to say, unless someone else has something to say. We're done.
Thanks.
for now. Thank you very much. Bye-bye.
Thanks, Eamon. Thanks,
Bye-bye.
everyone.
Thank you very much indeed.
Thanks, everyone.
Thanks, Eamon.